So now that you bring up
Yes.
hormone-responsive tumors,
Yes.
way back when dinosaurs roamed the earth and
Yes.
I was in medical school,
Yes.
we were always talking about androgen deprivation therapy, either giving estrogen or removing androgen-producing tissue. But this tumor sometimes gets resistant to androgen deprivation therapy. So what is the earliest indication we've got that there's resistance developing?
Well, I think it would be progression of disease. And that's where the comment I made earlier about maybe there are subpopulations that are different in different people comes in. Because it's unknown whether people become resistant to androgen suppression and get that classic stage, which nobody wants to hear, which is, I have castrate-resistant, hormone-resistant.
Or to put that into layman's language, I did that for nothing?
Exactly, yes. So, so when people hear that, they say to their oncologist or their urologist, what do I do next? And the answer is chemotherapy. And the question that's not totally answered is, did those people start out with a cell subpopulation of those, or did the androgen needing cells, when they got deprived, under that new environmental pressure, become androgen resistant,
You
castrate
selected
resistant?
out for those.
Exactly.
And what is the kind of time frame we're looking at from the onset to someone who might become androgen resistant?
I think
Androgen deprivation resistant.
Well, I think it's pretty variable, and I think some of the trials that are ongoing are trying to pick that apart. Could be a couple years. It's really hard to know. People respond differently, and we just unfortunately don't have enough of the population-based clinical trials to figure out which one, who is who. In other words, what box should we put different people into?
Well, how well, by the way, we've been discussing this heterogeneity as if it's a done deal and people know all about it and we've got all the research, but how well has this been defined in prostate cancer?
Not that well defined, and I think some of the trials that are ongoing are looking at that and looking at ways of trying to answer the question, some looking to answer the question by saying, well, what if we take people before they get androgen deprivation and hitting them with total androgen blockade plus traditional chemotherapy versus doing the traditional route of just androgen blockade?
Of course, I mean, I'll play devil's advocate. If you're going to do that, then you're making an assumption, unless you know for sure, that this is a heterogeneous tumor, and maybe you're making the assumption that everybody's tumors are heterogeneous.
Exactly, and we don't know whether some people start out with a larger group of cells that are resistant to the ability to cut off androgen. They don't care. And some people have almost none of those cells, but may convert, as you said, under environmental pressure.
So let's use the buzzword, signaling pathways.
Yes.
Is heterogeneity the result of activation of different signaling pathways? If these pathways actually exist, they probably do.
That's what's not known, and that's why we need to do the studies and put people in different categories and then look at cell surface markers and do other next-gen sequencing, because if we knew that, we would then be able to do that testing up front.
So